Hello, I am Yves Donadini, a TCM therapist, creator of the traditional Chinese medicine expert software, Zhongyi Pro. This video is the first of a three-part series devoted to the analysis of the afflictions engendered by COVID-19 according to traditional Chinese medicine. Today we will look at the etiology according to traditional Chinese medicine, that is to say the different patterns that stand out during a COVID-19 infection, as well as their dynamic evolution. The next two videos will be dedicated to treatments in Chinese Pharmacopoeia, then to acupuncture and acupressure according to the different stages of evolution, as well as prevention formulas. The sources are Chinese classical texts and experiences of Chinese doctors in the field. Some are official texts issued by Chinese government's medical authorities. This video is provided for information purposes only or as a help exclusively for professionals and students in traditional Chinese medicine or other related disciplines. Any self-medication is prohibited as it may be dangerous for individuals who lack the appropriate knowledge. Any medication or decision is your sole responsibility. If you are neither a therapist nor a student but know one around you, you should give him the link to this video, it can be extremely useful. Thanks for him. Let's start the analyses of external disease carried out in TCM according to three main paradigms which represent the evolution of the patterns from which patients suffer. Those paradigms are the 6 channels, the 4 aspects, the 3 burners. These interactive diagrams will be featured in the version of Zhongyi Pro that will come out in June 2020. The 6 channels correspond to the afflictions that at first manifest themselves as a cold. The other 2 correspond to wind heat afflictions or damp warm ones. Let's now focus on the coronavirus. The evil associated with this virus is what we call evil qi, which belongs to the epidemic pestilence type of disease. This evil is not part of the climatic ones, which are easily identifiable and usually responsible for external diseases of heat, dampness or dryness types. This is the reason why at the beginning of the disease, it is hard to identify which one is the responsible evil, as symptoms are a mild cough, fatigue and a slight fever. However, we have noticed that the early signs of the initial pathologies caused by the coronavirus are identical to those created by an external cold damp evil. The shapes that pathologies can take will vary according to the local climate and to the individual himself. In addition, these signs can evolve very quickly. There will therefore be multiple patterns to treat, so it is really about treating each pattern efficiently in order to be effective and not to worsen the disease. The purpose of TCM is not to eliminate the virus itself, but rather to improve physiological conditions to prevent the patient's health from deteriorating. It is not the virus that kills patients, but the impairment of vital physiological functions. The purpose of TCM is to restore these functions. In order to do so, we maintain these functions, but we also eliminate the new evils that will have developed by the alteration of these functions. The evils that develop during the illness are mainly cold, heat and above all dampness, which will be the main element to eliminate in all cases. It is because it will be necessary to eliminate dampness in addition to treating each of the patterns that the treatments will very often be a combination of 2 medicinal formulas. Initially, the disease can take 3 forms depending on the prevalence of cold, heat or dampness. First of all, let's consider the 2 cases where heat is not or only lightly present. These patterns are characterized by a superficial pulse, a very slight fever or an absence of fever, a dry cough, an absence of sweating, and a more or less significant aversion to cold. The first case is a form of external wind cold fettering the lung with a moderate cold and several signs of dampness. There will be a tense and tight pulse as well as a thin and white coating on the tongue. The second one corresponds to a wind heat damp type with very moderate heat. Dampness evil will be the key element to take into consideration, as it is responsible for the progression of the disease and is the main evil to eliminate. Here, the pulse is rather slippery and soft, and the coating is thicker, white or slightly yellow. Dampness evil tends to block qi and yang movements. Here, the first organ to be affected is the lung, then the spleen. If there is an initial spleen qi vacuity, cold damp encumbering of the spleen will be one of the first patterns after lung damage. This will be identified by digestive problems with diarrhea. Two scenarios then arise: if the patient initially suffers from spleen yang or qi vacuity, of the lung or even of the spleen, there will be an aggravation, which later can lead to a severe spleen qi and lung qi vacuity, and heart yang and lung yang vacuity. According to traditional Chinese medicine, the lung helps the heart to propel blood. In more severe cases, there will be a center qi fall due to spleen vacuity or a yang collapse due to severe heart vacuity, pulmonary edema, acute respiratory distress syndrome (ARDS), cardiac injury or kidney failure, etc. These patterns are serious emergencies with coma. Note that these patients will have reached these stages without developing a fever, sometimes within a few days. This mainly represents elderly people or patients suffering from impairments. Fortunately, this represents a small minority of patients only. The second scenario, the patient's constitution is stronger than in the previous cases. The evil will come in the form of damp heat, mostly in two aspects, which are sometimes the transformation of the cases seen previously. The two aspects are the upper burner warm disease, warm heat invading the lung, and again the upper burner damp heat pattern, wind heat damp, but this time with more heat as well as with dampness. On one hand, urine is clear with an increased volume for the signs of cold, and on the other hand, it is darker with a decreased volume for the signs of heat. Either the heat is already present in the case of warm heat invading the lung, or the dampness is transformed into heat inside the body in the case of wind heat damp. The pathology naturally evolves if there is no treatment for a yang brightness heat bind pattern. This is a severe case but is not life-threatening yet. This corresponds to the feverish state that is experienced with most seasonal flu. This stage is usually reached a week after the symptoms of the initial stage occur. During the first week, the patterns can fluctuate from one to another very quickly. Note that the Yang-Ming level heat accumulation pattern can be caused by the first cold wind pattern. We then refer to wind cold transforming into heat when there are both signs of external evil and internal heat. In practice, this means a rapid superficial pulse, a high fever, and a red tongue with a white or yellow coating. The upper burner warm disease, warm heat invading the lung, can also quickly progress to become a pattern of pericardium reverse flow. It is a pattern of serious emergency accompanied by a high fever, and that can lead to a coma. It is, however, relatively marginal. If not treated or depending on the patient's constitution, the Yang-Ming level heat accumulation pattern can worsen, and the heat can still progress inside the body. We will then be facing a case of severe superinfected pneumonia, or septicemia, and all the failures that this may imply, including acute respiratory distress syndrome, or multiple organ dysfunction syndrome. There are two other patterns to consider. The first one is the upper burner damp heat pattern, which may be the result of the wind heat damp pattern. The second one is a direct attack on the lesser yang by the external evil. Let's note the particularity of this last pattern. The evil is half internal, half external, with the presence of damp heat as well, but regarding the liver and the gallbladder with, as its distinguishing sign, a bitter taste in the mouth. It is remarkable to see that these last three patterns are those experienced by patients who suffer from malaria, and it is precisely an allopathic drug, chloroquine, an artificial derivative of quinine, usually used to treat malaria, which is currently used to treat patients infected by the virus. All the previously mentioned patterns are well-defined elements but are also quite dynamic. All intermediate and/or concomitant cases are possible. The World Health Organization considers that healing occurs 48 hours after the disappearance of the symptoms. After the official healing, doctors in China have observed several recurring impairment patterns, basically, stomach yin vacuity, and lung qi vacuity, spleen qi and lung qi vacuity. The mortality rate drastically increases with age, going from 0.2% for those under 40 to 15% for those over 80. Note that there is always the presence of the damp evil. Behind the previously mentioned vacuities, there will very often be spleen vacuity that will need to be managed to remove dampness from the body. The pulses are superficial, which indicates that it is an external attack. A slippery pulse will indicate the presence of dampness, a tight intense pulse the presence of cold, and a rapid pulse the presence of heat. The treatments will have to be adjusted according to the relative values of fever, cough, pain, headache, fatigue, intestinal disorders, etc. In the next video, we will see the Pharmacopoeia formulas that are useful in each of the cases we have just studied. We will also look in more details at the vacuity patterns that correspond to the remission phase as well as some prevention formulas. You can download the free and unlimited in-time version of Zhangyi Pro to see for yourself the different symptoms of the patterns we just talked about. Note that the diagrams of this video will only be available in the software update available in June 2020. We decided during this pandemic period to offer a 60% discount on the price of every version of Zhangyi Pro. Use the code NOCOVID19 on our website to benefit from this discount when purchasing any version of the software. Good luck to all.